Okay, so welcome back to my channel, everyone. My name is Justin Mullins RN, and I have a new video for you on cardiac medications review. This is useful for nursing students, people going to take their NCLEX, and yeah. So without further ado, I'll begin. And also subscribe to the channel and make sure you let me know if you want me to change how I do the next review video. Thanks. This is the meat and potatoes of my video. So this is cardiac medications review. First up is diuretics. Diuretics affect the urinary output of the patient to manage blood pressure and excrete excess fluid in congestive heart failure, or CHF. 4 types of diuretics are high ceiling loop, thiazide, potassium sparing, and osmotic. All 4 types block the reabsorption of calcium, chloride, and water. Commonly used diuretics include furosemide, hydrochlorothiazide, or HCTZ, spironolactone, and mannitol. Therapeutic uses are to treat CHF, pulmonary edema, hypertension, edema, diabetes insipidus. Mannitol only therapy is to decrease intraocular pressure and intracranial pressure. All of these medications can be administered IM, IV, and orally. Now, diuretics have side effects and contraindications when you do administer them. A common side effect of all 4 types of the diuretics is dehydration, hyponatremia, and hypochloremia. Look out for signs of hypokalemia with loop and thiazide diuretics because they are not potassium sparing. They get rid of potassium as well as sodium and chloride. If diuretics are being taken for hypertension, you want to make sure you check the blood pressure and educate patients to do the same when they're discharged or go home. And also use caution and monitor patients with renal failure and or are pregnant during the administration of diuretics. So the next up is blood pressure medications, which is one of the most common types along with antiisrithmics. So our first category is angiotensin converting enzyme inhibitors, which is our ACE inhibitors, which is a short name for them. ACE inhibitors reduce the production of angiotensin, thus increasing levels of bradykinin in the tissues. The expected result is vasodilation and excretion of sodium and water. These medications all end in pril, so captopril, lisinopril, and enalapril. Therapeutic uses of these medications include for hypertension, heart failure, and MIs, and patients at risk for cardiac events. Side effects are hypotension, usually after the first dose, cough, rash, and angioedema. Angiotensin II blockers, their pharmacological action is vasodilation of the veins and arterioles. Therapeutic uses and treatment are for hypertension, heart failure again, stroke prevention, protection against MI. Complications include angioedema again, hypotension, fetal injury, and dizziness. All of these medications end in sartan, so valsartan, losartan, and irbesartan. So watch out for lithium toxicity in combination with ARBs when taking these medications or educating your patients. Aldosterone antagonists are two medications, spironolactone and eplerenone. Their pharmacological action is reducing blood volume by blocking aldosterone in the kidneys. Therapeutic uses are for hypertension, heart failure, premenstrual syndrome, polycystic ovarian syndrome, and acne in females. Complications are hyperkalemia, hyponatremia, and fatigue and flu-like symptoms. Do not use this medication if you are pregnant unless it's necessary. Calcium channel blockers are next. So these are medications that end in dipene, except for two medications, which is diltiazem and verapamil. Nifedipine, amlodipine, and nicardipine are common medications. The first two commonly prescribed, and nicardipine is often used in stroke cases. Pharmacological action is it blocks calcium channels in blood vessels. It's used to treat hypertension and angina pectoris. Verapamil and diltiazem are primarily used as diuretics. Beta blockers is next. Therapeutic uses for beta blockers are hypertension, angina, MI, heart failure, tachydysrhythmias, migraines, reflex tachycardia, and glaucoma. Contraindications are bradycardia, AV blocks, orthostatic hypotension, which is when your blood pressure drops when you stand up from either lying or sitting, bronchoconstriction. So you want to avoid use in asthmatics and diabetics. Medications end in lol, so metoprolol, labetalol, propranolol, and atenolol. Sometimes these medications are used for treatment of PTSD. So, important slide here is medications used for hypertensive crisis. All medications in this list are administered via IV push, and the patient must be on a continuous ECG. So that's nitroprusside, nitroglycerin, nicardipine, labetalol, esmolol, and naliprolol, glividipine. Those are all medications given for hypertensive crisis. What's given will all depend on doctor, so make sure you communicate and read your orders thoroughly. Heart failure and cardiac glycosides is our next section. So cardiac glycosides, the only medication in this category is digoxin. Digoxin has dual purposes of increasing cardiac contraction force and to decrease the heart rate. Digoxin is used to treat heart failure and dysrhythmias. The complications are cardiotoxicity, nausea, vomiting, fatigue, and vision changes in the form of halos. And you always want to check the pulse, especially the apical pulse, before giving. Adrenergic antagonists are next. The pharmacological action changes depending on the medication given, but includes vasoconstriction for alpha, increased cardiac output for beta 1, and bronchodilation for beta 2. Therapeutic uses are anaphylactic shock for our alpha, shock or cardiac arrest for our beta 1, and asthma for our beta 2. Medications are dopamine, epinephrine, albuterol, ephedrine, norepinephrine, and dobutamine. Complications can include hypertensive crisis, necrosis. Now this is only in cases of extravacation of the IV site, dysrhythmias, and increased heart rate. Alright, next is our angina and antiisriythmics. So for angina, the only medication that we give to treat angina is nitroglycerin. Nitroglycerin is basically a vasodilator. That is its action of working. There are numerous forms of nitro that can be given. It can be given IV, sublingual, which is the most common, topical, translingual spray, or a nitro patch. Complications are headache, orthostatic hypotension, tolerance to the medication, and reflex tachycardia. If a patient is taking nitro, do not advise them not to consume alcohol, because it will make them more hypotensive. So next up is our HMG-CoA reductase inhibitors, commonly known as the statins, as they all end in statin. The pharmacological action of statins are to decrease the LDL, the VLDL, and triglycerides in the blood. So therapeutic uses include for hyperlipidemia, increasing the HDL, which is the good lipids in our blood, and prevention of coronary events. Complications can include myopathy and liver toxicity. Medications are simvastatin, rosuvastatin, pravastatin, atorvastatin, and ezetimibe. Now to our biggest important category here, which is our antiisriythmics. Say that 3 times fast. So first is our class 1A medications. So these medications slow impulse conduction in the atria, ventricles, and the Purkinje system. They're used to suppress SVT, or supraventricular tachycardia, AFib, A-flutter, and VTAC. Complications include diarrhea, cardiotoxicity, and hypotension. There are only 2 medications in class 1A, which is quinidine and disopyramide. Class 1B medications. These medications increase repolarization and decrease electrical conduction in the heart. They are used for short-term treatment of ventricular dysrhythmias. Their complications include drowsiness, altered mental status, and respiratory distress. So medications in class 1B are IV lidocaine, mexiletine, and phenytoin. Class 1C medications. These medications delay ventricular repolarization and decrease conduction. They are commonly used to treat SVT. Complications include bradycardia, hypotension, bronchospasms, and fatigue. Medications include propafenone and flecainide. Class 2 medications. These medications are beta blockers that inhibit stimulation of the sympathetic nervous system within the heart. The therapeutic uses are for AFib, A-flutter, paroxysmal SVT, hypertension, angina, and PVCs, which is premature ventricular contractions. Complications include sinus arrest, AV block, bradycardia, fatigue, and hypotension. Medications are propranolol, esmolol, and acebutolol. When you give these medications, you want to monitor blood pressure, pulse, and breathing. Class 3 medications. These medications are potassium channel blockers that prolong the action potential of the cardiac cycle. They are used to convert AFib and treat VTAC, VFib, and aflutter. Complications include bradycardia, pulmonary toxicity, and visual changes. These medications include amiodarone, oral and IV forms, sotalol, dofetilide, and dronedarone. Class 4 medications. These medications are calcium channel blockers that prolong conduction and decrease the oxygen demand of the heart. Class 3 medications are used to treat SVT, hypertension, angina pectoris, and to control the ventricular rate in AFib and aflutter. Complications include bradycardia, constipation, peripheral edema, and hypotension. Medications include verapamil and diltiazem only. Adenosine. Adenosine is only given in IV form. Adenosine decreases the electrical conduction in the AV node and decreases the atomicity in the SA node. It's used to treat paroxysmal SVT and WPW syndrome. Complications are vasodilation, dyspnea, and bradycardia. This medication essentially stops the heart for a few seconds, and the patient needs to be warned of that. ECG needs to be running, and IV push needs to be flushed instantly via the stopcock.